Do women have different symptoms than men in heart disease?
Yes and no. Women often can present like men do, but so many times, up to 50% of the time, women have very different symptoms of heart disease compared to men.
Do we know why they have different symptoms? What are some of the different symptoms? And before that, what's the leading cause of death in women?
So unbeknownst to most women, the #1 cause of death in women is cardiovascular disease, including heart disease and stroke, more than all cancers combined.
So they're worried about cancer, and heart disease is the thing that's going to probably get them, or has the best chance.
Absolutely.
So how are women's symptoms different than men?
So oftentimes women will have chest pain, but their chest pain might be different than men. But compared to men, women more often will have what we call atypical symptoms: shortness of breath, fatigue, weakness, palpitations.
Don't we all get shortness of breath, fatigue, and weakness, and little palpitations?
Absolutely.
But it's really important and serious. So how does, keep going on that, because I think that's terribly important.
Yes, so oftentimes women say, oh, I'm tired and fatigued because it's been a long day, or I've just gone through menopause, but it's unusual fatigue and weakness, unusual shortness of breath, anything out of the ordinary that can often be signs of heart disease.
So if they're getting out of the car in a parking lot and they're walking to the store, they have to stop a little bit?
Yes.
Would that be a possible symptom?
Potentially.
So going along with the shortness of breath were the other things you said.
Fatigue.
What kind of fatigue? What do you mean by that?
Fatigue, unusual fatigue with normal activities, going about your day, going to work, coming home, and just not having the energy that you used to.
Is this at a certain age for women? Is it more older or younger? It could be any age?
It could be any age. We know that young women more often are presenting with heart disease and these atypical symptoms. Postmenopausal women, about 10 years after menopause, have an increased risk of heart disease and can have those symptoms as well.